All right, so we've talked about the movement of goods from one place to the other. We've talked about transportation. We've talked about our sports, our creativity in terms of youth. But Ladi, we're going to now talk about how healthy is the population that we're looking at right now.
Indeed.
Isn't it?
Indeed. And in that regard, of course, we'll take Mary Alali Yusuf's report, particularly about how COVID-19, which is the most recent of the health challenges, has affected everything. And then when we return
of course, we have the Minister of State for Health.
We'll have the Minister of State for Health and, of course, the National Coordinator of the Presidential Task Force on COVID-19. Please stay on with us.
COVID-19 is the new phrase on everyone's lips today. And from reports, it started from a live animal market in Wuhan, China in December of 2019. And by mid-March had spread to so many countries that the World Health Organization gave it pandemic status. In Nigeria, as elsewhere, the infection grew exponentially, with every infected person potentially able to infect several others. Perhaps the most undeniable thing was the exposure of the Nigerian health sector as ill-prepared and understaffed for the pandemic.
But most of us say he didn't know that things were this bad.
As it is, we didn't do enough community mobilization.
COVID-19, a respiratory infection, is contracted through droplets from coughing, sneezing, or just talking, and by transferring the infection from hands that touch surfaces on which the droplets land. People are required to wear masks in public, wash their hands regularly, use alcohol-based hand sanitizers, and stay far away from each other. Every fever is suspect.
People were dying because the health workers were not equipped to receive them. They were so scared.
Schools and public places were closed and a lockdown was imposed, starting in Lagos, Ogun State, and the FCT on March the 30th. The effect on the health sector was devastating.
So we lost a minimum, I've done the calculation, a minimum of 5 billion in lost sales opportunity.
According to the president of the Nigerian Association of Resident Doctors, over 1,000 doctors have been exposed to COVID-19 and 16 have lost their lives. Businesses folded up and many people lost their jobs. Most interactions went online, and this has become the new normal. The government stated that it had spent over 30.5 billion naira on COVID-19 in 4 months, about a third of the capital health budget for the year, inclusive of the Basic Healthcare Provision Fund. At about 427 billion naira, the total health allocation comes to 4.14% of the 2020 budget. Yet donations towards the fight against COVID-19 from the UN Basket Fund, the Coalition Against COVID-19 and others has run into hundreds of billions of naira, and that's just cash. Isolation centers and labs were set up around the country, and the government handed out relief materials to cushion the effect of the pandemic. In spite of meeting a weakened health system, Nigeria, for yet unverified reasons, has been recording less infections and less deaths compared to Europe and the Americas. Though the Presidential Task Force on COVID-19 attributes this to a decline in testing, it is obvious that the strain in the country has less effect on the residents than in other parts of the world.
All right, thanks for staying with us. That's Mary Alali Yusuf's report. The COVID-19 pandemic significantly impacting a lot of sectors. So, as you promised while we're going on the break, let's introduce the Minister of State for Health, Dr. Ola, who is joining us from our Abuja studios. There he is, and sitting beside him is the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, who's become far much more familiar with us in the aftermath of COVID-19. Welcome to the program, gentlemen, and happy Independence Anniversary.
Thank you.
Ijeoma, you want to have the first shot?
Yes, I was going to start with
Happy
Senator Mamara.
Independence Anniversary.
Thank you. I was going to start with you. It's been said that looking at what happened to us, COVID happened to us. It happened to everyone. every country. Nobody saw it coming. I'm going to start with that. Some people have said that COVID-19 threw up the many challenges that we face in the health sector, or the state of the health sector as it is, and forced a response from people like yourself and others in the ministry. Is that a fair comment of the state of the health sector?
Well, thank you very much, Juma. And once again, happy 60th Independence Anniversary to you all. Now, yes, there's no doubt that COVID-19 pandemic hit the entire world, the entire human race, like a thunderbolt. It came and then ravaging lives and livelihood. So Nigeria is not an exemption because, yes, we do have a weak health system, but even countries that hitherto thought to have a robust health system, they caved in under the pressure and the assault of COVID-19 pandemic. And it only further compounded the already weak health system in our country.
Then say that COVID in itself was not a bad thing, in that it kind of prioritized health for us, the health sector, facilities, personnel, welfare, and all the other things that for so many years people had been crying about.
Yes, I always say that for seemingly bad situation, the tendency is there to also have some positive sides of it. And that's what we are witnessing with the COVID-19 pandemic. Yes, when you look at what has happened between February and now, our health system has been improved in terms of infrastructure, in terms of the healthcare, human resource for health, in terms of facilities, in terms of so many structures have been built and been appropriately managed to respond to the COVID-19 pandemic situation. So it's a blessing in disguise, if I mean, so to speak. And as we speak, there are additional facilities that are being built all over the country. And I can assure you at the end of it all, Nigeria will be better for it.
Okay, Honorable Minister, moving away from COVID-19 at the moment, I know we've talked about the fact that perhaps it was a blessing so we could do something about the state of the health sector. Some have said that we should move away from funding health to actually investing in health, not just in terms of the facilities, but in the people themselves, the doctors and the healthcare workers. Is there, I will come again and talk about a plan. Is there a bigger, broader plan or policy for them? Because we constantly see them either leave the shores of this country to work in other areas, and the ones that remain are not particularly happy. What is the plan for healthcare workers?
Well, the plan is holistic. When I say it's holistic, you are looking at the governance structure as it affects health. You are looking at human resource for health. You are looking at research. You are looking at community participation. You are looking at so many other things. And of course, we've talked about medical tourism. And the question is, why do people go for medical tourism? It's just, looking for what you desire, what you want. For example, patients want to be in a hospital and feel as if they are in a 5-star hotel. And we had that before in this country, in the early 60s and late 50s, where people were also coming here for medical tourism, so to speak. So we are looking forward to having those glorious days come back in terms of the facilities that we have on ground, and the health can ordinarily, yes, one can say it's a social issue, you know, but then we can still do business even in the health sector, because you're looking at people want to do investigations and they want to be sure that the facilities are there to do investigations that concern their health, and of course have their appropriate results and have their appropriate treatment. So we are looking at all this holistically. And of course, we are taking care, we are looking into how best to take care of with the workforce in the health sector. And that's why a lot of programs are being put in place in terms of the security, whether, you know, death benefits, in terms of health insurance, in terms of for the workers, and so many other things that we want to put in place that will make our own health workers to stay within rather than wanting to go abroad.
All right, Dr. Liu, let me come to you, because obviously you've been in the news often, and you've at the briefings we've seen you harp home, try to hit home the message about what the citizens need to do to keep themselves safe. Looking back at our health sector and just what you've experienced with COVID-19, where do you place the role of the people themselves in terms of safety and hygiene?
Thank you. So congratulations, first of all, to all of us, to all Nigerians. We have come of age at 60. As far as the COVID pandemic is concerned, clearly this is the biggest, the biggest public health crisis of our time. And it's not just a health issue, it's also a socio-economic issue. It has affected countries across the world. Some of the developed economies have lost at least a third of their GDP. The UK, for instance, they've lost about 17 years of growth. So it's been disastrous for the socio-economic side. But we have been relatively lucky in Nigeria. We've been relatively lucky in terms of the number of deaths we've had. 1,000 deaths is still too much, but compared to other countries, it really isn't that high. But what do we need to do? We at the PTF continue to be very concerned about the level of compliance with some of these non-pharmaceutical interventions. Now, the earlier presentation we had, they talked about whether the strain, the coronavirus strain in Nigeria is probably different. That's not true. Part of the reason why we haven't had so many deaths is the nature of our demography in terms of age. We don't have a lot of elderly people compared to other countries. We have a relatively youth bulge, and youths generally don't tend to have a severe infection. But nevertheless, for every elderly person infected, the likelihood of death is still significant. We've looked at our numbers. If you're above the age of 65, you have an almost 1 in 5 chance of dying if you catch COVID. And again, I would caution when it comes to the numbers, as you correctly said, we are not testing enough. And we know that even within the PTF, for every single positive we have, we're possibly missing between 7 to 10 cases of COVID-19. And I remember at the beginning of the epidemic, when there was a lot of talk about India, and people saying that, oh, it's surprising India hasn't really had a nasty outcome. And see what's happening in India now. So I would be very cautious. We will continue to work with communities, we'll continue to work with government and the private sector, but it's really important that people continue to protect themselves and continue to protect their loved ones. The 3 key non-pharmaceutical interventions that we have pushed through, the use of face masks, for instance, the hand washing, and the maintenance of physical distancing is crucial if we want to interrupt transmission. COVID has not gone away. We shouldn't be complacent, and as you can see from the NCDC numbers, they fluctuate quite a lot. Some days we have less than 100 cases a day. Some days, like in the last 24 hours, we've had about 200 or 210 so far. So those numbers will continue to fluctuate as the number of tests change. We have given resources, the federal government has given resources to the states, and we are insisting that the states use these resources to improve testing and to improve surveillance. And if that happens, we're going to be testing a lot more in the country, and there's a likelihood we'll have relatively higher numbers than what we are currently having at the moment. It has not gone away. It's not uhuru yet. We need to continue to protect ourselves and protect our loved ones, particularly those that are most vulnerable to having severe infection.
All right. Before I ask you for your closing comments, where are we in terms of finding a vaccine? I know the last time we talked about this, different remedies, traditional alternative medicine, and all that had been submitted, and they were supposed to go through NAFDAC and all that. Where are we? Are we any closer to finding a vaccine here in Nigeria now, not globally?
So what I would say is it's far more likely that a vaccine will come from outside the country. From the domestic side, we are not anywhere near finding a vaccine. At the moment, there are at least 7 candidate vaccines that are being trialed. They've reached clinical phase 3 trials. Some of them look quite promising, but it also depends on the efficacy of the vaccines. For vaccines that have efficacies of less than 40%, forget it. They're not going to work. But again, I will remind Nigerians, we already have a form of vaccine with us. And these are the protective measures that we currently are pushing. They are far more effective than any vaccine we are likely to have. The problem with them, of course, is compliance. But even if you have an effective vaccine, it will not be as effective as you wearing your mask, a combination of wearing your mask, washing your hands, keeping physical distancing, and making sure you observe respiratory etiquette. They will not be as effective as those 4 measures. But of course, we very much welcome our scientists in country that continue to work, but the level of investment in terms of research, etc., in country makes it very unlikely that a vaccine will be found from the domestic source. It's far more likely that it's going to come from outside the country. If it does, we are already working with our partners to make sure that the vaccines will be available to 2 groups primarily: healthcare workers and those that are vulnerable, i.e. those above the age of 65 and those with comorbidities, etc. But we'll continue to work. NIMA, for instance, is already doing quite good work when it comes to the diagnostic side. I'm sure you've heard of the molecular assay that they've developed, which we are currently going to make sure that they put through the normal validation to make sure that it's competitive and it has similar performance to what we currently have. But from the domestic side, I would say a vaccine, we're still very far off from having a domestic solution to vaccine. But we already have an alternative that is just as good. And we will continue to ask Nigerians to please observe those alternatives.
Let me ask the Honorable Minister of State, while thanking Dr. Aliyu, let me ask the Honorable Minister of State, let me take a cue from the question Ijoma has been asking, and to ask you in this final moments of this segment to look forward. Where do you think the health sector post-COVID would be, say, in the next 5 to 10 years?
Well, post-COVID in the next 5 to 10 years, as you said, it will be better for it in terms of facilities, infrastructures on ground to assist us and move us further in our healthcare system generally. But having said this, it is also important to say that that collaboration and partnership that we need, vertically, that is from the national to federal, to the state, to the local government, of course, to the communities as well. And of course, the partnership with the private sector in terms of boosting the facilities and the healthcare generally is very, very key. And maybe on a final note to say that it is important for individuals to take primary responsibility for their health. We say you are what you eat. So whatever goes in, whether alcohol, well, people that smoke, we say smoking is not good for your health because we are beginning to see increased number of non-communicable diseases, which, smoking takes a very, very high percentage in this aspect. And of course, we also want our people to bear with us, particularly because we've seen a lot of posts on social media. We are in a period of pandemic, in which case people must be willing and ready to bear with some level of discomfort.
All right, then, Dr. Mamora, thank you very much. An onerous task it is, superintending the health sector, especially during a time like this. But we wish you the very best of luck alongside Dr. Sani Aliu, the National Coordinator of the Presidential Task Force on COVID-19. Thank you, both of you, for joining us. Happy Independence Anniversary. And as a parting shot, using you as a point of contact, let us thank all the health workers who have worked during the course of this COVID-19 pandemic. We sincerely appreciate their efforts and their hard work, and wish them the very best as we continue. Thank you so very much.